Good morning, you guys. I'm gonna start my morning with you guys again today. Um, I always start off with moisturizing my face. So I'm gonna just moisturize my face. And today I am actually getting ready to get out of here so that I could actually go to. I have a first aid CPR class that I have to attend. So I am going to do that today. So that's what I'm getting ready for. You guys, you see my forehead? I've been breaking out a lot up here. Like these blackheads out of nowhere, and I hate blackheads. So I be trying to do everything I can to get rid of them and to get them out. Um, yeah, so now I got some marks up here, but they'll go away, especially with using this vitamin E. I know it'll help. It will definitely help. But yeah, you guys, so I'm going to a CPR class, and if I'm able to show you guys a little bit, I will. I don't know what I'm gonna do with my hair, honestly. I'm thinking to just do a slick back ponytail with a puff at the end. So let's see how that turns out with this thick mess that I got going on here. I'm just gonna spray it with some water and conditioner. It's in my bottle, which I always do every day. The back, you know, the back be thicker than everywhere else. Oh my goodness. Pray for me, you guys. Pray it that I don't break the teeth in the comb, okay? Where is my big comb? My wide tooth comb. Oh my goodness. Where is my wide tooth comb? Oh gosh, I guess this one is gonna have to do. You see that? I can't even get my comb through the ends of that stuff. Ooh, and I ain't even trying to. I'm not gonna lie. I don't want no parts of it. Put some more water on it. You know, put some water on. Hopefully that'll help it out. Some conditioner. Put some conditioner on there. Let me moisturize my lips. So today, you guys, I'm going to try to, guess what? I was thinking about it, and this sounds pretty crazy to myself, but I think I'm going to go for it. I'm going to try to do a makeup tutorial with you guys. And don't come for me in your comments because I have no clue what I'm doing. That's why I only wear it sometimes. Okay? Because it take me like 2 hours just to do it. Forget the eyebrows. That take me like 40 minutes. Girl, I'm telling you, it'd be a mess, a mess, a mess. You hear me? I'm going to try though. I think I'm going to come back. When I get back, I'm going to try to do the makeup tutorial with you guys. Okay? And if there's anybody that that does makeup and you can give me some pointers, please do. Let a sister know because I'm gonna need your advice, okay? And like I said, I do not know what I'm doing. I've just been watching YouTube videos for the past year, trying to. That's how I got hooked to YouTube in the first place, looking at makeup tutorials, and yeah, pretty much that's all that started me with it. Honestly, with YouTube was looking up makeup tutorials, and I definitely do better than I used to years ago. But because I never really wore makeup, so it never was a priority for me. But now that I'm, you know, aging, I want to be able um, to wear. If you guys, I can't look at you in the mirror at the same time, so just bear with me, okay? But now that, like I said, that I'm aging, I would like to be able to wear not a whole lot of makeup. I do not want to do a whole lot. I just want to make it look as natural as possible, but with a little pop of makeup to show that I do got on a little something, but nothing crazy, you know? I gotta go slow, because it's not like I've been wearing makeup forever. So all that white stuff you guys see, that's gonna dry up. That's nothing but water and conditioner and gel, mixture of all three. That's all that is. this puff, boy, I tell you, it's so thick. Whoo. Oh, man. I don't want to do it too tight. Because I'm going to be in a training for the next 6 hours. But, yeah. I just wanted to come on and just show you guys a few different ways that you can wear your natural hair. When you're not, like, doing all those professional natural hairstyles like I see most of the girls do on YouTube. I just don't know how to do all that stuff. And not that I won't try. I don't know. Maybe, I don't know. Not that I won't try. I will. But I just... some of them be too much. You gotta be doing all these parts and doing all these sections, and why you just can't do something simple, you know? That's what I'm thinking. Why you just can't do something simple? But anyway, this is my little puff, you guys. My little slick back puff. And again, like I said, all this white stuff will, as it dries, it will, it'll fade away. All that stuff you see in my scalp, that's just some, that's just from the water. That's the conditioner that I put in here, mixed with the gel and the water and all that other good stuff, you guys. So I just came on to do this with you guys, and then I'll pick you guys back up again later. Yeah, I'll pick you guys up again later. I just wanted to say good morning to you guys and get ready, get my hair done with you guys. And thumbs this video up, you guys, if you like my little puff. It's thick, y'all. It's thick. Jeez, I tell you, it's so much. But if you put a lot of conditioner in it and put some gel, like in them roots, that's where it counts. You gotta get them roots. If you could get them roots moisturized, then you'd be good to go. You guys like my little puff? All right, you guys, I'll see you guys in a little bit. Look at these guys. So we're gonna be using these to practice on. We'll be practicing on these. Stay tuned.
Heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches, and for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin, and tilting the head back to a past-neutral position. For a child, you'll only need to tilt the head to a slightly past-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until
14, 15,
you notice an obvious sign of life.
21, 22, 23,
An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24,
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2 and 3 and 4.
Cool. Okay, so what we're going to do is, you have a partner. One person's doing the CPR stuff first. One person's going to be watching, okay? We're not going to switch for some time. So don't say, hey, partner, now you give it a try. Nope. I'll let you know we're going to switch. The first group practice, we'll build it up, and we'll eventually test you on it. Then we'll switch the who's doing what, okay? Now, these mannequins are pretty cool, all right? These mannequins are going to let you know if you're doing it right, and they'll let you know if you're doing it wrong, all right? Which is pretty cool, okay? So, as we approach the victim, we check our scene, right? Got to make sure our scene is safe. And as we approach the victim, what are we doing as we approach? And that's shout, tap, shout, okay? And then we check to see if the victim is doing what? Breathing. We check for how long? 5 to 10 seconds. If they're not breathing, you're going to tell your partner to go do what? And 3 things, really. Call 911, they're not breathing, give me an AED. Off they go, and you're going to get right to what? Right to compressions, okay? CPR starts with compressions. This part of your hand, the heel of your hand, is going to, that part of your hand, is going to be the lower half of the sternum. And if you don't have to, but you can do this to yourself. Take this part of your hand, put it on your own sternum, not off to one side or the other, right in the middle. Go down to where for the soft spot. Oh, that's too far. Bring it up a little higher. That's where you're going to be, okay? Lock your elbows, lock your wrists, keep your fingers and knuckles off. So only that part of your hand is actually touching the mannequin, okay? You're going to want your shoulders directly over top of the mannequin. So you're going to be on the floor in a minute. You're not back here, but you're right over top of the mannequin. Now these mannequins, when you do your compressions, which are how deep?
2 inches.
How deep?
4 inches. No. 2 inches.
No, I thought it was 2.
How deep?
2 is for the infant.
What was the wording they gave you for the adult? At least 2 inches deep. Oh, Eric, you're so picky. All right, at least 2 inches deep for the adult. It's about 2 inches for the child. Okay. And what's the rate? How many compressions per minute? 100 to 120. It's fast. Okay. Now the mannequin's going to let you know if you're doing it deep enough and correct. It's not going to tell it to you, of course, but it's got lights. You're going to want to see 2 green lights. So if you're going the right depth and speed, you're going to see 2 green lights on the left collarbone. Kind of the bad news, it also lets you know if you're doing it wrong. Don't freak out. But if you're not going deep enough, it's actually going to give you a little bit of a shock. It's not a lot, but it's a low-level shock for every compression that's not deep enough. All right, so you'll feel it. I'm kidding. It's not going to shock you. That would be cool. That would be cool, right? That'd be awesome, all right? So when you're going down the right depth and speed, see those 2 green lights? If I don't go deep enough, I get a red light. And also, no more click. See that click? Not deep enough. Deep enough. Now if I go too fast, I get a flashing yellow light. So I want to let the chest rise back up. Don't press down and go into rapid fire mode. Let the chest come back up. You push down, let it come back up. Push down, let it come back up. Push down, let it come back up. You're just doing that fast now. All right? After your 30 compressions, then 2 breaths. So you'll put your face shield on. Put one hand on the forehead, just kind of like a little C, right like this. Put 2 fingers in the chin. Please don't give me this. Don't rest your arm on the mannequin. Just 2 fingers, bony part of the chin. Tilt the head back. You'll pinch the nose when you give the breath. Let go of the nose in between breaths. So all you're going to do is tilt the head back, pinch the nose, blow for 1 second, let go of the nose. Don't sit up. Just turn your head away. You inhale, pinch the nose, make the seal, and get the second breath. So it's just going to be tilt, and then get right back to compressions, okay? If you blow too hard or too long into a real victim, if you start going into a real victim, what's that victim going to end up doing on you?
Aspirating.
They're going to throw up all over you. Yeah, you don't want that, okay? Believe it or not, these don't, but there actually are mannequins that will throw up on you if you blow too hard too long, all right? Actually, no, wait. There actually is one that does that. I don't know which one it is. So just be careful. No, there actually are mannequins that will do that. These don't. But they really do exist, okay? But if you do it right, you will see the stomach and chest rise up and down. Okay, just a 1 second breath. You just pause long enough in between to inhale, pinch the nose, get the second breath, and then get right back to compressions. Remember, once you start CPR, you really should look like a what?
Machine.
You're a robot.
machine.
All right? Again, I know it sounds silly, but that really is what you kind of look like. Okay, so go ahead, put your gloves on, grab your face shield, get with a partner. I don't know if one person's not going to partner because I know we got 11 people, that's fine. Go ahead, come on down here. Come on down to the mannequin. Get on opposite sides of the mannequin. So you should be looking at your partner with the mannequin in between. Figure out who's going to go first, you or your partner. Doesn't matter who goes first, makes no difference. And if you're going to go first, if you're going first, get on that side. If you're going first, get on this side like I am. I'll let you cut it out.
All right.
Only got 5 minutes.
Okay. Thank you.
They have a nice instructor. I really like that. Nice. All right. But these little packs only come with 5. Man. Go figure.
Keep this. I should keep it. I'll be fine.
Yeah, when it's your turn, you can use yours. So we can switch around, it's fine. Okay, so if you're going first, get in position for compressions, put the heel of the hand where I showed you. I'm just going to make sure I compression first, correct first. Lower half of the sternum, get your fingers pulled back, lock your elbows, lock your wrists, bring your shoulders towards your partner, so your shoulders are right on top of the mannequin. All right? There you go. A tiny scratch lower, actually, chest a little lower. There you go. No, higher, actually, higher. Lower the higher. So stay off, higher.
Okay.
Stay off the little triangle right there, stay on that. There you go.
Okay.
There you go. And there you go. All right, I'm going to say ready, set, go, and knock out 30 compressions. We're all going to count. It sounds like this. 1 and 2 and 3 and 4. Count out loud. You must push hard. Okay? So bring your shoulders forward. Here we go. Ready, set, go. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 5, 6, 7, 8, 9, 30. Sweet. That was good. Now, if you see it flashing back and forth between 1 and 2 greens, that means you're going to a teeny tiny scratch slow. So you have to go to a teeny tiny scratch faster so that 2 greens stay on. So after your 30 compressions, then you put the face shield on. Tilt the head back. Don't force the head back, just tilt it back slightly. Pinch the nose. Now open your mouth up wide. You got to make your mouth open up wide, make a good seal. So make a seal, blow into it for 1 second. Take your mouth off and inhale, and then do a second breath. And then just leave your face shield right where it is, and then go right back to your breath. 1 and 2 and 3 and 4. Just keep going. You count. You don't even might have to count to 30. Oh, that's a good correction. Yeah, so watch out for flashing yellow. Good, good. Tiny scratch. There you go. Tiny scratch faster. There you go. 2 greens.
And 30 again?
Yep. Tilt the head back. Pinch the nose.
Pretty nice hit on the whole time.
Sweet. There you go. So put it back. Make it go a little harder, ladies. Somebody pull a little harder. Make it like a complete seal. Make it fully commit to it. There we go. There we go. Now, put your chin below us. Do a second breath. Do a second. There you go. There you go. Beautiful. There you go. All right, you can stop. Sweet. That was awesome. Okay, take your face shield off. Don't bother standing up. We're going to take it from the top. We're just going to pretend, instead of getting up and getting down over and over again, we're just going to pretend we're standing. Okay? So we're going to take it from the top. I'm going to talk you through it. Just stay with me. So here's the situation. You and your partner have walked into the room. You see an adult that appears to be unresponsive. What's the first thing we always do? We check what?
Check the
Scene.
Don't look around. Don't look at me. Look at the scene. Make sure it's safe. All right? Well, the scene is safe. So now we can approach our victim. So we're going to shout. We're going to tap one of those shoulders and shout again. Go ahead.
Hey.
All right, now, look, get your head down. See if they're breathing. Look at the stomach and chest. See if they're breathing. See if they're breathing. See if they're breathing. See if they're breathing. All right? In terms of they're not breathing, hey, partner, call 911. Get a name. They're not breathing. Now, no face shield yet, because we're going to go right to compressions, right? So don't even reach for your face shield, because in real life, you probably don't have your face shield on yet. You're not even going to reach for your face shield yet. We always go compressions, compressions, compressions. So go get a position, And go. You're on your own. You count. Partners, tell them out. Encourage them. Tell them good job. Or if they do something wrong, don't be mean. So let them know. Now put your face shield on. Do your 2 breaths. Bring the face shield a little low. There it is. Against the nose. Good. Good. There you go. Not too hard. Not too hard. Just a light breath. Just a light. That's it. That's it. Perfect. That's it. Right back to it. Yeah. Right back to it. There you go. Remember, you're a machine. Don't stop. Just keep going. You're a machine. Anti-tornado. All right, EMT said stop, so you could stop. Do victims actually have lights on them? No.
You gotta press the hammer really though.
Yes, yeah, you gotta push really hard. And you've got to think about, use some common sense though. If you're big and strong, and your victim could be maybe very old or frail, well, yeah, you gotta be careful, because you could go down too deep. But most responders who are responding to most victims, you've really got to give it quite a bit, huh? Even if you are fairly big, or fairly strong, and your victim about the same size as you, you're giving it a ton of It's gonna take a lot. All right, most people don't go deep enough.
I just got a quick question, real quick. I had to do this last year when an elderly person was using techniques. Their body was still warm, her eyes were open, and the 911 director to start them. The police showed up and stopped me, and he took his fist and he beat her chest with his fist 20 times. So I was scared to death.
You're not gonna do that.
No, is that what he was supposed to what?
No, actually, that's not actually a part of the protocol right
Yeah,
now.
I know, but he took his fist and he just kept hitting her chest and kept as hard as he could. So
Yeah, that's the cardiac thumb. There's an idea behind that. We're talking about the AED section.
Okay.
But that's not part of the protocol. That's really not what done.
Okay.
All right? Unless there's some protocol in that area that I'm unaware of, and
Yeah.
probably not
I've
that.
never seen anybody do that before, so I was just kind of.
Well, there actually used to be some called a cardiac thumb.
Yeah.
Before they actually started CPR, they actually would. Bam!
Yeah, that's
Bam!
what- yeah.
That's actually the idea of trying to disrupt the electrical activity of the heart and get it to restart back with the rhythm. That's what the AEDs are for. Okay, take your face shield off. Let's try this out again. Let's test it. So same exact thing. Ready? So first things first, check your scene. Ground. All right. Scene is safe, so you're going to shout, tap, shout, and see if they're breathing. Go ahead. Get down. See if they're breathing. See if they're breathing. See if they're breathing. See if they're breathing. Tell your partner what to do.
Go call 911.
Go call 911.
There you go. Get to work. Don't watch them walk away. You get to work. Once you command your partner, you get to work. You're not going to say, bye, partner. You're going to get right to work. Let it rise. Let it rise. Just move it. Stay in contact with it. Just let it rise up. There it is. Yeah. Now face shield on. Take it right in between. Not too much. Take a breath. Right back to it. Take a breath. Right, second breath. Right back to it. So 8, 1, 2, right to it. Keep your elbows locked. Use your body weight. Good. Watch out for flashing yellow. Go hard. Let it rise up. Let it rise up. There it is. Good. You got it? Good? And you can leave the face shield on there, Jake. Once you put it on, you can leave it on.
All right.
It saves you time. It saves you time. Right back to it. That actually opens the air. All right, EMT said stop. So good question. So what's the purpose of tilting the head back? Well, when the victim's laying down like this, they're unresponsive, the tongue is going to relax, and it's going to cover the back of the throat. When you tilt the head back, it pulls the tongue away from the back of the throat and creates an open airway. So for the adult, you got to tilt the head back past neutral. For a child, you don't go as far as the adult. You got to tilt the head back for the child, just not as far as the adult. If you go too far back in the child, you actually close it down. Okay, take your face shield off. We're going to do it one more time. So this time, I'm not going to tell you what to do. All right, so let's pretend it's a real situation. So act like you would in a real situation, okay? So here's the deal. You and your coworker walk into a room. You see another coworker who appears to be, this is an adult, who appears to be unresponsive. So first thing, of course, take your scene. Let's do that together. All right, scene is safe. Keep going.
Ma'am,
Are you okay? Can you breathe? Are you okay? Hello?
Ma'am, are you okay?
Oh, go call 911. Go call 911 right now. Go call 911.
don't mess with it. Don't mess with it. Right. Lower half of the sternum. Stay off the tip of the sternum. You don't want to be the tip. You want the lower half. Put the head back and just blow. Put the head back. One blow. Inhale. Second breath. Right after you inhale. You go right back to questions. Right back to it. Sheen. Yeah, we'll talk about that in a second. It's a good question. Sweet. All right, EMT said stop, so you what?
Stop.
All right, take your face shield off. Yay! Now, hold on to your face shield. Don't get confused whose face shield is whose. That would kind of be the purpose. You guys did fantastic. All right. So what I'm going to do is I'm going to come by and do a little surgery. All right. Now, you're not going to take someone's lung out in real life. Please don't do that. That would be very, very weird. All right. You will get in trouble. You will go to jail, and we will hear about you in the news. All right. They're going to say, you taught your CPR class. And you're going to try to save me, and I'm going to deny it. So how will I? So I'm going to come by and put a fresh lung in the mannequin, and once I do, if it's your turn, go ahead and start practicing. So you can go ahead and start practicing.
All right.
And you can either take a break, or you can keep practicing, because I'm going to change yours.
Give us something better to get it.
No, predator compressions your breasts. So you can go ahead and put your face shield on.
All right.
So partners help each other out. You just did it. So help them look for the 2 green lights. Put your face shield on. Make sure your breaths are going in. There goes Amber. You can go ahead and start making sure you get the 2 green lights. You can put your face shield on. Make sure your breaths are going in.
Practice.
All right. So you can go and practice. Wait. Grab your face shield. Let Amanda have her turn. Oh yeah, by the way, let me address Amanda's question. She was asking about, is it possible? She said that, she says when you hear do compressions, you may break the sternum, crack a rib, those kind of things. So on your very first compression, or any compression thereafter, you might hear a snap, crackle, pop.
Make sure your elbows are locked.
So if you hear a snap, crackle, pop in real life, what do you think you should do?
Keep going.
So first of all, double check. Make sure your hand is in the right position. And make sure you're not going too deep. Because if you're big and strong, you could go too deep. But if those check out and you heard the snap, crackle, pop, you just keep going. Remember, they're in cardiac arrest. Do I really care about breaking a rib? No. And that snap, crackle, pop you heard may have just been the sternum, which is actually not bone, that's cardiac.
Do 30 of those. There you go.
Keep on.
Lights.
Look at you, impressions are good there.
Like a leaper.
There you go. Yeah. There you go.
Hey, Eric,
And once you get
Yes.
30.
our lights aren't working anymore.
And that is an automatic fail.
You broke
So you guys,
You broke it.
y'all can come back next Thursday and try.
Yeah, pinch the nose.
Okay, in a second.
Keep practicing them. 3 and 4 and 1 and 6 and 7. Oh, yeah, so I'm not. No. I got
Make sure you pinch the nose.
Hit your nose, front and nose.
All right, Jennifer, what did you do?
I watched you, you broke.
What did you do? You got your face shield thing?
I just.
Just realized I put on it all?
Oh, there you go.
Ah, man, maybe go deeper. Let's go hard. How we doing? That's it. And just go lock your elbows. Come a little closer. Come a little closer. That make it a little easier. There you go. And now lock your elbows so your shoulders are right over top, so your arms are perpendicular to the floor. That's right.
Like don't use your arms, use your shoulders.
Right, same spot.
Push with
There
your
you go.
arms more.
Yep. Now bring your shoulders more towards him. Come forward.
Okay.
Now lock your elbows though, so your elbows are still bent.
Elbows gotta be straight.
Your elbows are bent. Lock straight. Keep them like that the whole time. Yep, don't bend them. Don't bend them at all. Push your body down hard. Push, don't bend them. Lock your, push your body down hard. Hard.
Okay.
Straight down, hard. Hard, there you go, hard every time, hard. There you go. There you go. Just keep those elbows as locked as you can. That's it, beautiful.
Deeper.
And we're getting tons of practice.
I'm not strong enough.
There you are. Try to, come a little closer, too far away, come closer. Now lock your elbows. Bring your shoulders toward us, come forward. Now go straight. Straight down as hard as you can. Try to hit the floor with the heel. Hit the floor. Hard. Straight down, hard. Hard. Even harder, even harder.
Said lock. Keep them.
Keep them
Even harder,
straight, so
even harder than
they
that.
won't bend at all.
Okay.
Your speed is good. Don't worry about going faster. Just go like 5 times as hard as you can. Try to make this part of your hand bottom out the middle. Like you're almost punching through the person. And now get everything back. Get your fingers and stuff back. So only that part is actually touching right there. Yeah, that's it. Yeah. There you go. Hard.
I think that's
I think that's how that's supposed to
Hard. Keep going. You see your speed is good. Actually, go in a tiny scratch higher. A tiny scratch higher. There you go. Try that.
real good.
I saw yours.
I was watching them do the.
That's gonna make it harder. Lock everything. Make it all like your shoulders are straight down. Like that, yeah. There you go. Put that time.
There you go.
All the way down. Down and up. If you're gonna try to do this, that's gonna make it hard. You're not
Keep
gonna
those straight.
keep all that straight. And just like drive your shoulders straight
I feel
down.
like I'm having a workout.
That's what I was thinking. That's what I was
Love that.
He's like,
Yeah.
What hand are you drawing with?
Which one's right?
When you're good off.
Okay, so keep everything straight.
No, it's not right.
So don't do
Make
this.
sure.
Make everything straight. Just let your shoulders drop straight down. Just put all your body.
Make sure you make a seal with your
Smush
mouth
it.
on it.
I would slide your knees up a little bit closer.
Yeah, you slid back
Your
again.
knee- Yeah, your knees need to be like almost as close to
Bring
you.
yourself.
Nope, it hasn't risen.
All the way up.
Are you
Don't look at that.
Right.
Make sure your hand is on top of the chest, because that can stop it from rising up as well.
Now just smush the man. All your body straight.
Put the head back a little bit.
Smush it. Smush it. Straight down hard. Hard. Smush it.
So there's no air.
And don't worry about coming back up. Just do
There
this.
shouldn't be any noise.
Just make it smush it. Just smush it. Put all your body in it. Hard as you can. Smush it. Now come back up. Now let it come back up. Stay in contact. Do it again. Smush it.
Triangle.
Come back up.
Try and blow it as much as you
Smush it.
can. I don't know why
Smush
it's
it.
not.
There you go. Come back in.
Take a deep breath.
There you go. Got it. Smush it. There you go. And then come back up. Smush it again. Come back up.
I just wanted to watch my
There you go.
eyes out just in case something happens.
Try that again.
I'll ask him, but I'm not saying it's right.
You're almost there. You got the speed, you got the position, you're almost there. It's not quite deep enough. So you're stopping right about here. And not quite getting to
You're
there.
not going fast enough. You gotta do it faster.
Once you go down, even just one time deep enough, the little light will kick it down, it's gonna stay red, if you don't keep going.
Let the chest come all
But
the
you're
way
not
up
quite- you're not
before
getting
you
in the
push
first
down.
one yet.
That's why the yellow light is blinking.
Hard. Just keep working.
Oh.
All right, let's try putting it together.
Wait,
So,
we have-
yeah,
Oh, I was just asking, she needed help on her.
the breath?
Yeah.
I was wondering
she
why it
wouldn't
wasn't
fill
there.
out.
Oh, wait, okay, try it again. Tilt the head back. Just tilt the head back. And just think, just take your facial there. So watch this. All you gotta do is just, you have your facial there, just tilt, pinch. Takes 1 second. So do that. So tilt, pinch. Yeah, no, maybe put your mouth on it. Keep it tilted, keep the head tilted.
Yes.
Make a seal.
It's still there.
Yep, that's perfect. Put your mouth, all right, fully commit to it and blow. Blow as hard as you can on time. Even harder. You can stick your mouth on, inhale, take an inhale, then put your mouth fully on, fully commit to it. You made it go up, it made it go harder though. But take a breath, take a breath.
It wasn't rising.
Bring the facial a little bit lower. A little lower, there you go. Now just do this. Take that hand away for a second, that hand, just take it out of the way. Just stay down there. Just do this. Pinch the nose, just pinch it. Tilt the head back. Now put your mouth down, put your mouth like this. Smush it. Smush the face with your face.
Okay.
Smush it. And then blow as hard as you can when down. And then try it again. Open your mouth really wide. Open your mouth as wide as your mouth can possibly go. Make a good seal on it. You know, let me try something else. Take your face shield off. That looked pretty good actually. Take your face shield off. Looks like you're doing good there actually. Just a little surgery. There you go. Just try it again. Put face shield on. A little lower. Just pinch the nose, tilt it. Don't delay. Just tilt it. Push back. And blow. Put your mouth on. Fully commit to it. Blow as hard as you can with time. I hear air escaping, so I think you open your mouth wide. So you gotta make a good seal. Make a total seal on it. Make a full seal on it. I can hear the air escaping off to the sides. You're not gonna make it a seal, so really put your mouth on it.
My back is
Yeah,
straight.
just like smush
Try
it.
to put
Spread
your
that out.
try to put your whole mouth over the hole.
Over top of my
Whole
shoulders,
mouth,
and I'm
everything,
right next,
everything.
I'm like actually right over top of them.
Inhale, there you go.
Kind of your- you
Blow as hard as you
got
can.
it.
Blow hard one time. There's
Your
blood.
arms are like this, one straight. Isn't that right? Your arms are.
No, it's not right. It looks like you're doing it right. Just trust
You
me.
want me to try and see if it's wrong? Like, if I
Well,
try-
now let's try this. Take your face shield off.
This in line,
Let's try this.
straight line.
So hard.
No, it should be. It looks like you're tilting the head back. You got the head back tilted, so that's good.
Now just push with your shoulder, don't.
And
push
it sounds like there's still some
Push
air
right
escaping
here.
from the side of
A
your
little
mouth.
bit further.
So when you do it, you
almost
don't want
there.
your mouth above it. You want
A little
to
harder.
put your mouth.
Not faster, not faster.
Just keep your head tilted. So you can't halfway do it. You gotta fully commit.
Yeah.
Otherwise, the air is just going to escape from the side of your mouth, which we know it's going to escape. And it's not going to actually go into
I just didn't know if it was
the little lung
working.
bag here.
That's right. It's
Yeah,
working.
she's like totally pushing your head down
Alright,
every
let's try
time she
again.
does it, yeah, you got it.
No, this is
Put more
bad.
upper
Show
body
you
into
right
it.
there.
Tilt the nose, yep. Tilt the head
More
back.
upper body.
There you go.
Still straight arms, you
Right
want
there.
that,
Yeah.
Wide your mouth out.
straight arms. You're too far away.
Hallelujah.
Blow hard, blow hard, blow hard, blow hard.
All the way down. You're not, yeah.
Yes, right there.
That's right. Really open your mouth up wide. Fully commit to it. Fully commit. Smush the mouth. Smush it. Well, bring the face shield a little lower. Let's say get a little higher. Bring the
Well,
face
you got it
shield.
to
Bring the
light
face
that
shield a little
time,
lower.
so
That
that's.
white
Oh,
circle
look,
stays in the
there you
mouth.
go.
There you go.
You gotta use that hand to kind of spread it
Got
out.
it, harder.
There you
Just
go.
a little bit harder.
Not
Thumb,
faster.
your two fingers right there. Push it.
Yeah.
So it stays right there. Now it's okay. That's it.
Well,
Now
you
really open your
got
mouth
it.
wide.
You got the,
Open
you
it,
got the
open it.
light, the green light came on.
Mhm.
You just didn't get both green lights
Stop
on.
blowing.
You were almost
There you go.
there.
That's better than it was.
Try again. Try again. Blow, blow, blow hard. Blow
Right,
your
I
mouth.
know.
Look how big this thing
Something clicked.
Keep trying. That's just a little
You
spring in
kind
your
of
head.
use your legs a little
Open
bit.
your mouth up. Really open your mouth up. Really fully commit to
Why
it.
you
Smush it.
before, like.
And the, well, I mean, yeah, that's what I meant, like
And
before.
really using.
Wait, keep the head tilted back.
Don't bend your elbows. You're losing strength when you bend your elbows.
Sometimes what happens is the
But I got the idea.
sometimes what happens when you put a new lung in it, you have to actually
Yeah, this is where you're gonna get
Sort
the
of.
strength. Yeah, from right here, you don't
Pop
want to
the
use the
lung.
palm of your hand.
not a real lung.
There, you got this
So
lip.
go take
Wherever
your
you
take your face
did,
shield off.
keep that straight. Deeper.
You got it that one time, you did.
Maybe it's not still not. Then maybe you put your back into it more, not just your arms. No, now you're pushing over this way.
So sometimes you gotta kind of pop the lung over there.
Nope, right here. Right here. Like this.
Oh, I see what you mean.
That's why it's not coming out.
Yeah, because I had a stroke on one. That's what it says for about stuff.
Yeah, it's a lot. Because you
Yeah,
feel like you
I don't have to
exercise
find
your
it.
arms when you do that. It's
Yeah.
tiring.
Yeah, it is.
It feels like exercise.
I don't know.
Well,
Like,
so
like
I
you're
was
running.
thinking,
Feels like-
I said, "Sorry, because I made a plate in the sun, so I always put this on my top because it's not as strong to hold the pressure."
Right, yeah. And that's why, like, even though I'm here, like, I'm a lot stronger than this arm. So, like, I can always put as much pressure with one arm, but people do with two.
Okay.
Just like, you know,
And you're still sitting down.
Put your hands here on that chin.
that's why I don't know
Take
if
a deep
it affects
breath.
it at all, you know, because
I wouldn't.
because I don't want it, because if I do it like
No
this,
way.
I do it.
There you go.
It's more comfortable.
Oh, you're at it. It's getting better.
See, it's working
Got
here.
the green.
Okay, we're working. 2 abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
All right, you guys know that stat?
10%.
Yeah, each minute CPR defibrillation delay reduces chance by 10%. It's huge. Okay. Okay, so remember, what was the break-off for CPR? What was the break-off age for adult child? About what?
12.
About 12. But for AED, it's different. So if you got someone who's under the age of 8 or under 55 pounds, we use the pediatric pads. Focus more on the weight, really. If they're about 55 pounds or over, use the adult pads. Just use your best judgment. All right? If they're kind of borderline, use adult pads. Okay. Yes, the pediatric pads are smaller, but what's the real difference?
Hi you guys, so I just wanted to come back and close out the video. I hope you guys enjoyed that little bit that I was able to offer in my CPR. It was a CPR first aid, adult first aid. It was CPR adult first aid and AED class. So I had to do that, take that class and get my certification, and I was able to complete that. So one less thing I have to worry about for another 2 years. So I was able to do that, and I hope you guys enjoyed it. And I just wanted to say bye to you guys and close out this video. I hope you guys enjoyed. I'll see you guys again soon. I did promise you a makeup video. Like I said, I am not a professional, far from it. Almost like, you'll see. Don't worry. You will see. And don't be coming for me either, because I already told y'all I don't know what I'm doing. And if y'all know what I need to do, y'all help a sister out. Let me know what I did wrong, what I should do, products I should try, and things of that nature, okay? So I'll talk to you guys again real soon. See you later. Bye-bye.